Fox 45 is your back-to-school headquarters. As children are getting ready to return to the classroom, we're focusing on their mental health. The New York Times reporting the urgent need to care for children's mental health has been rising for years, but it's spiked during the pandemic. And joining us live to discuss how you can ensure your child's emotional needs are being cared for, we have psychotherapist Dr. Jan Winhall. Good morning.
Good morning, Shelley.
So you focus on treating trauma. Before we get into ways to treat it, how has the pandemic been traumatic for children?
Well, I think the pandemic has been traumatic for the whole world because what's happened is that our bodies do not feel safe. And when bodies don't feel safe, we have this wonderful autonomic nervous system that kicks in that says, whoa, where are we going here? And most of us understand this system in terms of flight, fight, freeze. So the polyvagal theory added another piece to this, Dr. Steve Porges' work, where he talks about shutdown. And so now what we're seeing is that this system in the body, we're all kind of scanning, and our kids are really activated by this and probably excited about going back to school. So there's some really nice kind of energy there, but also nervous and scared.
And so looking at this, if you really understand this and what kids are going through, this can help you know how to help them.
Yes, absolutely, because we also need to be able to help ourselves. So what I did is I created this CALM, an acronym that helps us to remember the important pieces about how to work with the nervous system, and also a graphic model that's fun, especially for kids.
So what does CALM stand for?
CALM stands for, the C stands for co-regulating, and this is a term in polyvagal theory, which is really about how, say you and I are sitting and having coffee, and I feel you're in that flight fight place, I might go up into flight fight with you. So we kind of have these contagious ways that we interact. And with parents, it's incredibly important because how we are in our nervous system shapes how our babies and our children develop.
Sure,
so if children are already living in flight, fight, freeze, and shut down states, they're going to have a lot harder time.
Okay. We've got about another minute left. I want to get to the rest of this model, if we can quickly, and how parents can incorporate this into their daily lives.
So asking your children, paying attention to what's going on in your body, and asking your children, what's it like for you going back to school? And if they're really little, they'll know what's going on in their bodies, and you can ask them, what happens in your body? You may start to see a lot of like jumpy stomachs, things like that. So being able to a very easy little quick one is through breath.
Okay.
Breath, through extending that exhalation breath, the body goes back to calm.
Okay, that's good. That's
yeah,
good to know.
So a very simple way to remember to pause in your family, check in with your kids in the morning, ask them, how you doing? Let's do a little calm breath. Breathe in for 3, out for 5. And you can do that during the day if you feel upset. And then I'm going to ask you how it went when we all sit down together at dinner.
Just taking that time to slow down, because it can get hectic, and you know that can get lost.
Well, it does get lost, except that it doesn't totally get lost, Shelley. It gets lodged in the body. And then we're flaring up, and it's really happening tremendously now in a very, very scary kind of way, because we don't have the resources to deal with that.
If people want to learn more, where can they go to learn more?
Polyvagal.org, the polyvagalinstitute.org. Also focusing the felt sense piece, they can go to the International Focusing Institute or to my website. Lots to explore, to be in the body.
All right, Dr. Jan Winhall, good stuff. Thank you.
Thanks so much.